The first topic I want to talk about today is the explosion of semaglutide, also known as Ozempic. And it is an explosion. It's been kind of crazy how many more patients I've seen coming through my practice that are on semaglutide. Okay, so when I say semaglutide, are you guys familiar with that term, or do you guys know it as Ozempic?
I know it as Ozempic.
You know, what about you, Charles? Or do you know any of the terms?
No, so I know it is Ozempic.
Okay, all right. So
except for from like about a week ago when we mentioned it.
last week when we did the show. Yeah.
I don't know if my my FBI agent that lives in my phone, like if they heard something, but like I got an ad on Facebook for Ozempic.
After we did the episode?
Yeah, like
dude,
2 days
how messed
later.
up is that? That happens to me all the time, and I don't like that stuff.
I've never gotten an ad for that
like
kind
Big
of
Brother's
stuff.
listening in.
I was like, what is that?
And you're like, wait a second.
Why are you doing this? Like
We were just talking about
I
that.
don't think I've ever looked it up. Like,
I'm telling you, man, the phones they're listening to you.
it's weird.
Yeah, crazy. So semaglutide is just the generic name for Ozempic. Wegovy is the other kind of brand name, I think. I think those are very similar. So if you guys don't know about semaglutide, this is a medication that initially was created for diabetes. And one of the side effects they found in the people that were taking this drug for diabetes, they start to lose weight. And so the mechanism of this is that it's a glucagon-like peptide agonist. And so in very generic terms, that means that when you take this drug, it stimulates this receptor, and that receptor makes you feel full.
Yeah.
And it also affects how quickly your stomach empties. So when this receptor gets stimulated, you don't want to eat. And it's actually very, very effective. And this medication is given by an injection. So it's an injection that you can give yourself or your doctor can give you, and you do it once a week. So it's super easy to take. You don't even have to remember to take a pill every day or multiple pills a day. And it has some very mild side effects. You know, this isn't a drug that people generally have to stop taking because it's too bad. It's mostly GI stuff, things like, you know, maybe some diarrhea or constipation, or maybe I feel nauseous. But in general, the side effects are pretty mild, and most people don't report them being significant enough to alter them taking the drug or not.
Yeah.
Do you guys know people that are taking this? I mean, I
know a handful.
So we take, you know, these intake sheets of people come to our practice, so we know when people are on it. I see tons of people on it, but do you have friends that are on it?
Yes.
You do?
Yeah,
Like a lot?
my
Or
sis.
Huh?
My sister.
Oh, your sister's taking it?
Yeah.
Is she? Oh, so how long has she been taking it?
For a while.
Did I ask you this last week?
Yeah, for a while.
I'm having deja vu.
A little.
Really
I
weird.
think she's been taking it for probably a little over 6 months.
Oh, really?
And she's lost almost 40 pounds.
Whoa, that's crazy.
I was talking
Man.
to her about it maybe last week, and
Yeah.
I was asking her how much they increase her.
Right. How much she's
dosage.
taking, yeah.
I've already forgotten what she said, but
Yeah. Good. Excellent.
woo. But it's very small. It's really, really
small dose.
small. And then her doctor also said that there's like a max amount that she's allowed to take.
Yes. Yeah.
But yeah, she's really excited and happy with the
I
results.
bet. Travis,
And-
do you know people
yeah.
taking Ozempic?
I do. I
Do
know
you?
at least 2 people.
Really?
That take it, and they're both women.
And you always wonder how many people are taking it that don't say anything about it, right? Because you can only imagine if, for how many people you know are taking it, there's probably 2 to 3 times that many that are taking
Yeah.
it and not saying anything.
I'm interested because you said like it slows down the rate at which it
Emptying.
empties from your
Yeah.
stomach. I wonder what's like the normal rate. Like a healthy human, like what is the normal rate of a stomach emptying?
I'm not going to be able to give you some very technical data on that, but I can tell you that when we take people to surgery, we like them to have nothing to eat or drink for 8 hours, because after 8 hours, your stomach really
Should be
is
empty.
complete. It is completely empty.
Okay.
If you're taking this drug, even up to 24 to 36 hours later after eating, there's still food left. So
See, and that would be the only thing that I would think would that raises my eyes a little, like my little eyebrows a little bit. Is just because I'm like,
See, if you
is
had
that
Botox,
healthy?
you couldn't do that.
No, I need it
Well, think about it this way, there, Sarah. So that's a great question, Sarah. That is food
because it's
being-
like unnatural for your stomach.
Yeah,
to
but
have
think about
that
it. Like,
food
where
in
does the
for that
food
long.
go after it leaves your stomach? Well, it just goes into your intestines, and
then
the same thing
out the
happens. It sits
toilet.
around there, and it kind of slowly, goes down the line and
Yeah.
gets absorbed
But
or not.
yeah, I was just thinking about that because I know your stomach has like acidic stuff in it, and I don't. It's like I wonder if that like causes.
I mean, that's a great
Stuff.
question. We're not seeing any significant kind of side effects as of yet, and it's been out now for a few years. So, great question. But really,
I
to
wonder
this
about
point,
like acid reflux or something.
I mean, that is one of the side effects they talk about is mild reflux, but once again, not something that's really.
One question that I do have.
Okay, bring
like,
it.
So
I hope I can answer it.
how long, I guess, like, is there an expiration period on, like, when people take it? Because you said it's been out on the market for a couple of years. Is there an expiration period where, like, okay, after like 5 years, it probably doesn't have any negative effects, and like.
For sure, man. Like this drug gets out of your system pretty quick. That's why you have to take it weekly. I mean, weekly is a long time frame for a drug. That means that the mechanism of action or the half-life is actually longer than, say, like, you know, your blood pressure medications, which you got to take every morning, right? But, you know, that doesn't mean that it stays in your system for months and months. I mean, you know, when we're talking about surgery and you know, making sure that people you know, aren't going to have issues with having food in their stomach and surgery.
Yeah.
I think the current stipulation is you have to be off of it a minimum of a week, which means that after about a week, it's kind of out of your system. Now, there might be trace amounts left, but I don't think there'll be enough to affect you. You know,
Gotcha.
yeah, what's saying. But well, the one thing that is, you know, very cool about this, and your sister results are showing this, because her results are actually better than average. So the average patient taking semaglutide or Ozempic at 3 months loses 6% body weight. So that's total body weight. So if you weighed 200 pounds, that'd be like losing 12. At 6 months, it's 11%. So that'd be like 22 pounds if you weighed 200. And then at 12 months, it's 15 to 20%. So your sister's ahead of the curve. I mean,
I think it's because she's just eating better too. Sometimes
Yeah.
she'll send
Well-
send me pictures of like her making like good like healthy smoothies and stuff, and I'm
Yeah.
like, good job.
And that's the thing is, you know, and I say this about a lot of things, but you know, it's always easier to lose weight when you're closer to your ideal body weight, right? As the saying goes, it's easier to make money when you have money. Well, it's easier to lose weight when you're not so far past where you want to be that exercising is really difficult. Also, too, when you start to lose that weight, it really kind of inspires you.
Yeah.
And then you start to eat better, and I'm sure that's probably what's happened with your sister.
Yeah, she has like that little fire under her
Yeah,
butt.
she does, man. That's great. I'm really happy for her.
So-
So the big question is, you know, for at least our industry is, you know, is semaglutide going to affect plastic surgery? And I think without question it is, and I actually see that already today because we'll get patients, even today, which I still think we're early in the semaglutide craze, we'll get patients that come in today that say, hey, you know, I've lost weight, and then we'll ask, oh, how'd you lose weight? Did you do it on your own? Was it surgery? Because weight loss surgeries are still a thing, or was it semaglutide? That's a new question we ask now that we didn't ask a year ago. And some people are saying, I lost 30 pounds with, you know, Ozempic, and now I don't have as much breast volume as I want to have, and I want implants, or they'll like, you know, have extra skin around their tummy, and they'll want things like a tummy tuck. And we saw this whenever the gastric surgeries came out. You know, body contouring was not as big of a thing prior to the gastric sleeve, gastric band. Are you guys familiar with weight loss surgeries? Heard of those, right? Yeah, okay. Yeah, so those started to really gain a lot of popularity when I was doing in my general surgery days. I did so many gastric bypasses, I couldn't even count them. And then what happened was people started losing weight, and it was the same thing. Like, you know,
then they needed to tuck in.
they needed some tucks, they needed some augmentations, you know, the things that we see the most are breast surgeries, whether they be lifts or augmentations. Tummy tucks are really popular, and those have always been popular because of pregnancy. You know, not everyone sails through pregnancy like you did, or my wife's the same thing. She went through pregnancy and never really didn't change her that much at all. But a lot of people really get hit by it.
I have a feeling if I ever get pregnant again, I'll get hit.
You might. It's
'Cause
always
I'm
hard.
older now.
Each pregnancy you have after the first one, like your chance of having, you know, changes goes up.
Yeah.
But yeah, it's like we're already starting to see a little bit of that, and I think that the more people that take this and get results, it's just going to keep going. And so I think body contouring is going to be on the rise, which is already popular, but I think we'll see an uptick in things like, you know, breast lifts, breast augmentations, tummy tucks, arm lifts, you know, where people get like the arm skin, and then thigh lifts. I think you're going to see an uptick in that. So I mean, you know, it's good. It's the only downside of losing weight, right? Is it brings into question, you know, does your body look better when it's a little bit heavier without the loose skin, or do you look better when you're thinner with loose skin? I mean, that's kind of a gray area question. I mean, it really depends on how much weight you lose and how much loose skin you have. But, you know, a lot of people lose the weight, whether it be, you know, from Ozempic or weight loss or just on their own. And then it's like, well, I have this, you know, these changes I don't like. Well, I mean, that's where I come in. So.
Yeah. Well, like my sister, I'm pretty sure that people that need to lose like a substantial amount of weight, when they get on that, that's like part of their plan.
Yeah.
Like my sister's is,
Sure.
I'm going to do this, and
Yeah.
then I'm going to get my mommy makeover,
Yeah.
and then I will be done.
I wish we could get insurance to cover these things. I mean, we'd
Well,
have people beating down the door if they could.
Well, I hope that the insurance starts prescribing it to people that are like on that borderline
So,
of like becoming
yeah.
diabetic, and I
That-
hope it like decreases the amount of diabetes in the world.
It will, for sure. One thing that's happening and how this thing is kind of exploding is most people are not getting it through a regular prescription. A lot of people are getting it through compounding pharmacies. And so they're getting it really cheap, which is nice. So that's where we're seeing a lot of the people get it from. They're not getting like a prescription from their doctor to go to the pharmacy to pick it up. Like they're getting it through their doctor's office via compounding pharmacy, where they create it there as opposed to getting it from the pharmaceutical manufacturer.
Yeah.
And then they send it to the patient. And we do that for a lot of drugs. I mean, a lot of the numbing creams we use for people that are getting lasers and whatnot
Right.
are all compounded. That's a really
Is that
common
like
thing.
another word for like off-brand?
What's that?
Is that like another way to say off-brand?
Yeah.
Or like
yeah.
generic?
It's generic, but it's also generic to the point that it's not created like at some big pharmaceutical industry complex. It's literally created in
Yeah, so it's like
in the pharmacy.
buying like the Walmart version
Yeah,
of a product
yes.
versus the name
Kinda,
brand.
yes, yeah,
Okay.
exactly. Yeah. And it also makes it really cheap because I don't know, I can't remember what the cost is on Ozempic if you get a prescription for it. I want to say it's
My sister said it's very expensive, and she said she was lucky
Really?
that her doctor prescribed it to her.
okay, so
because
she did it that way. All right.
she was a person that was almost on the verge of becoming like insulin dependent. So
So obviously now she's lost the weight, no?
yeah, but
Much
she could still she's probably still borderline.
Really?
Yeah.
Well, if she keeps up the weight loss, that should go away.
Yes.
Typically it happens with weight gain. You know, if people are heavier, they start to get pre-diabetic, so.
Yep.
Yeah. Well, it's interesting, how things have changed just in the past year or two. Like 2 years ago, nobody was talking about this, and now literally it's like not all we're talking about, but I mean, it's a very
I
common
mean, I'm
topic
getting
of discussion.
Facebook ads for it.
Yeah, I know, right? Big brother.
It's so weird.
So if you out there have questions about Ozempic or semaglutide or any of those, please leave us a comment. I'd like to know what you think. Also, leave us a like and a subscription. It really does help us moving forward to bring you guys a lot more topics. So.